Okay, my name is Annie Bailey. I'm doing my project on Alzheimer's disease and exercise with people in this population. A little rundown on what Alzheimer's disease is. It's a neurodegenerative disorder, so it's characterized by the loss of structure and function of neurons. This just means that it affects the brain and the brain tissue is essentially dying. Some signs and symptoms of Alzheimer's disease. One that most people typically think of, one category is cognitive dysfunction. So this includes memory loss, difficulty with language, executive function, organization, just general forgetfulness, which is the very first most known sign of Alzheimer's disease. As it gets more severe, psychological and psychiatric changes definitely will occur. So this is mood changes, getting pretty agitated, behavior changes that come with some of the confusion that Alzheimer's causes. And like most severe would get to impairments in activities of daily living. So these people are unable to live independently and have struggles performing everyday activities. Risk factors associated with Alzheimer's disease. Age is a huge one. This is the most prevalent one. There are a lot of things that aging heightens the risk for, and some of those diseases were kind of blanketed around how age affects Alzheimer's. So metabolic, cardiac diseases can be risk factors along with age. Genetics is a huge component. There have been chromosomal linkages to people with Alzheimer's disease and how your chance of acquiring Alzheimer's disease is significantly heightened if a family member also has Alzheimer's. And environmental factors, this is mostly has to do with the progression of Alzheimer's disease. Environmental factors, medications, therapy received where you're living, who you're living with, they can affect the progression of disease. And I recently learned that 6% of the 65 plus population is impacted by Alzheimer's disease, which I thought was kind of a significant amount. Diagnosing Alzheimer's, so it's a clinical diagnosis. A lot of testing goes into it when you see these signs and symptoms. So a complete medical history is done to assess your risk based on your genetics and that component that we discussed. Cognitive function tests, there are several. One example that I was seeing a lot is the clock test, and people have probably heard of this one. So I have this image of a normal cognitive test and then an early Alzheimer's disease and a late Alzheimer's disease. And you can see that the spacing of the clock gets significantly more impaired. This has to do with like awareness, confusion, the neurological deterioration Alzheimer's disease causes. And lastly, in the clinical diagnosis is an assessment of acts of daily living, how somebody is able to function independently if they're able to complete daily tasks without forgetfulness and those kind of symptoms. So here's just a graphic of the progression of Alzheimer's. There are 3 stages. The early is probably, again, what most people think of. Forgetfulness. I don't remember where I put my keys. I spent all this money and I don't know where I spent it. Some examples, symptoms they listed. Middle stages are where you start to see more of the psychological progressions. So delusions, compulsiveness, easily agitated, losing track of time, those kinds of things. And late is when people start to become completely dependent on others, unable to recall or finish conversations, lack of awareness, even sometimes lack of mobility and physically functioning. So management of Alzheimer's disease, there is one pharmaceutical that seems to be making a significant impact in this population, and those are cholinesterase inhibitors. So as an exercise specialist, it's important to know how this could affect their physical activity. And some of the symptoms listed were muscle fatigue, dizziness, loss of appetite. So it's really important to make sure that these patients are taking their medication with food. It's going to enhance their memory, but it also could lead to soreness and muscle fatigue more than they would without being on this medication. Therapeutic interventions, cognitive rehabilitation was listed. It really is dependent on the individual, how they can tolerate it and their needs. So some sensory exposures and behavior therapies were listed. The relationship between exercise and Alzheimer's. Ability for a patient with Alzheimer's to exercise is really dependent on the stage of the disease and their individual symptoms. So the earlier stages, they're most likely still able to stay on task and not be physically impaired, whereas the later stages, it's much more difficult to exercise. So before being diagnosed, some intrinsic benefits for cardiovascular health and personal health are come with exercise. So that may eliminate some of the disease risk factors that come with aging, exercising early on in life. But also once diagnosed, it can be a treatment. So there are studies that have shown a decrease in the decline of active daily living. So people have been able to be independent for longer with their Alzheimer's disease if they implement exercise. This is really most effective on patients in their early stage of Alzheimer's, because as it progresses, it becomes more difficult to implement exercise with those individuals. There are also some studies, there's still a lot of research going on, but there are some studies that were saying that increase in cerebral blood flow can promote neurogenesis, so creating new nerves as those nerves are being damaged in the brain, so it slows down the progression of Alzheimer's. So for the case study, Craig is a 75-year-old male. He is currently retired and lives at home with his wife. Past medical history includes Alzheimer's disease and a recent fall. He reports no pain after the fall, but has not been active recently for fear of falling again. Initial assessment reveals he is otherwise a healthy adult. His wife reports that he has been more forgetful lately and his mood has been fluctuating. The patient has been cleared by a physician to start mild exercise program with goals to improve balance so he can continue going for walks with his wife. And he currently takes medication to manage his Alzheimer's disease. So an initial conversation, I would include an informed consent and a PAR-Q for this individual. And since he does have Alzheimer's and is prone to forgetfulness, even in his early stage, I would have his wife, who is his primary caregiver, involved in that conversation. Past medical history would also want the wife to be present for that, obviously, as Alzheimer's and the recent fall. So those are, and the medication, those are the things to keep in mind. Exercise history, hasn't been exercising lately, used to walk, has been sedentary. So have to keep that in mind. And his goal is to be able to go on walks again. So establishing all that information is really important for his prescription. Exercise testing. So the timed up and go test I would use for aerobic and balance. He is a fall risk, and that is a short duration. So you would have to closely monitor him, but it is a good indicator of how quickly he is able to get around. Resistance, I would do a sit to stand. Again, because he's a fall risk, it's better to have him getting up and out of a chair than walking around or using exercise equipment. And flexibility, I would do a chair, sit and reach. He's an older individual, is a fall risk. Having him get all the way down on the ground is probably not the best idea, so I would incorporate the chair and modify it a little bit for him. For his aerobic prescription, I would do 3 days a week to see improvements and be able to meet his goals. A 40% heart rate reserve for intensity, keeping it on the lower side of intensity as he is an older individual. 30 minutes a day is the minimum I would recommend, but because he does have Alzheimer's and is prone to forgetfulness, it might be better to break it up into 10-minute increments and progress as he can or modify it as tolerated. Since he is afraid of falling and his goals are to get back walking daily, I would definitely incorporate walking into this prescription and maybe some steps up and down, just to get him a little more confident in his acts of daily living. Resistance, I would do 2 days a week. Intensity, 30 to 45% of his, based on his resistance training, starting light and progressing as tolerated. This is typical to do with the older population and definitely with Alzheimer's patients. For time, 3 sets of 12 reps. Because I'm going to have him on such a low weight, I would do higher reps. Type body weight exercises and bands, incorporating any exercises he may like more than others. I would avoid free weights with a Alzheimer's patient because of the potential risk as the disease progresses. Flexibility, we definitely want to do daily to see greatest improvements. Should be stretching to slight discomfort, but should not experience any pain. Have to reevaluate if he is experiencing pain. To see improvements, 3 sets of maybe 20 seconds, definitely static stretching, avoiding dynamic because he is a fall risk and can still improve flexibility being static. I would include a balanced prescription for sure. Daily exercises to fatigue based on what he can tolerate, how confident he is, just trying to build up that stamina so that he can confidently be going for walks every day. I've listed a couple example exercises, but would use a handrail at least at first until he gets a little more stable. Some special considerations for patients with Alzheimer's. They need to be reevaluated frequently because as their disease progresses, their ability to exercise can change. His medication can lead to greater fatigue, so trying not to overwork him too much, making sure he and his wife understand that he may be more sore due to the medication. Like I said before, doing short bouts of exercise so that he's able to stay on task for longer. That is a symptom of Alzheimer's, not being able to stay on task. So shorter bouts may be more beneficial in getting more done. Something else I read is that the disease tends to have the lowest severity in the morning. So maybe doing training sessions then to see the best results. Definitely would have to depend on the patient. And because he is 75, you should consider other risks.